together, either in the states or transcend state lines, so that the insurance companies would be bidding for that association's business to help bring down the cost.
And your question, ma'am, is,
I
please.
want to know, why did the AHPs get tabled? Why did that not go any further?
Well, let me speak for Maryland, if I might, because we already had that in Maryland. We had small market reform. The Maryland legislature passed small market reform. It was interesting that there was no partisan difference in our state. Both Governor Glendening and Governor Ehrlich both wrote us letters in opposition when they were governors to that proposal, because it would have undermined the market reform that the Maryland legislature had passed. So if you're a small company in the state of Maryland, there is an affordable product, a more affordable product, I wouldn't say affordable, but a more affordable product available to you, which is actually lower cost than what an association health plan would have provided you. It's still very expensive for small companies. We believe that enacting comprehensive reform, insurance reform, so you can't underwrite, you must community rate, that's going to be the best thing for small companies, where you can get the exact same cost structure in an insurance product that a large company can get. That's what we're trying to do now.
I'll be doing the translation. Buenas noches, Senador Cardi. Mi nombre es María Teresa. Vengo con Casa de Maryland. Soy residente del condado de Prince George. Nosotros tenemos una preocupación muy grande, el cual es que no tenemos clínicas comunitarias de salud al servicio de la comunidad más necesitada. Mi pregunta es, ¿vamos a tener expansión de clínicas comunitarias de salud en el condado de Prince George?
Good evening, Senator Cardin. My name is Maria Teresa, and I'm here with Casa de Maryland. So I'm a resident of Prince George's County. We have an important topic that we want to be able to put it up here, which is that we don't have community health clinics in Prince George's County, and there is a lot of community that are in very large need. And my question is do you support the expansion of community health clinics in Prince George's County?
The answer to that question is yes. There are community health centers in Prince George's County. There's not enough, and we need more. The bill that I have co-sponsored would double the number of community health centers in the nation, and we have a little over 100 in the state of Maryland, and we could clearly use twice that number. So yes, I support expansion of federally qualified community health centers. I think it would provide primary care in the community to the people and would actually save money.
Day Gardner, Bowie, Maryland. With the, you mentioned, first of all, good evening. You mentioned special interest groups earlier. With $350 million going last year to pay for abortions in the United States, my question is, why not take abortions, which is the #1 killer of black people in this country, take abortions out of the health care plan altogether? I'm sure it would be easier to pass, especially since 19 Democrats just recently came out against the abortion plan in this health care.
The abortion issue brings out sharp differences in our community, and I'm not going to try to reconcile it tonight. I must tell you one thing. It is not a cost issue. It is a very important policy issue for our nation. I understand that. I don't want to minimize it. But it's never been looked upon as a cost issue because we could get into the specifics of it, but it doesn't, whatever side you're on the issue, it won't have a major impact on costs. Now, I happen to be in favor of what's known as the pro-choice position. I don't want to say I'm not, that's how I believe, but I think the healthcare system should be neutral. It should allow a woman to get the healthcare needs that she needs, but it shouldn't require a provider who doesn't want to provide abortion services to have to provide abortion services.
Good evening. Currently, the cost of malpractice insurance for doctors is at least $150,000 a year, and it is causing many primary care physicians and community health clinics to leave the field of medicine and or are being replaced with physician assistants who only have 2 years of medical training. How will this new act decrease the cost of malpractice insurance for PCPs and other non-special physicians so that the quality of our health care is not continuously sacrificed?
I think that's an issue that may very well get into the debate. We have not had much of a debate on that, mainly because health care insurance has been mostly state, and most of the battles have taken place in the state legislature. But I just really want to underscore the point that Dr. Schell said earlier about unnecessary tests. If you really want to get to the major area of unnecessary tests, then let's use technology so that we don't have to continue to repeat or use protocol that is not called for tests. And if we develop that, then I think the liability issue also becomes a much easier matter to handle. I agree with you. We want to get the liability issues much more under control. The system does not work well today, and it's an issue that I would expect will be taken up by Congress.
Hi, I'm Paul Mendez, and I'm from Wheaton, and thank you very much for organizing this event. As several of the questioners have already alluded to, between 15% and 20% of the people without health insurance here in the United States are illegal immigrants. Would you support giving the affordability credits to people that are here illegally? And if someone who's an illegal alien doesn't purchase their own health insurance, would they be fined the same way we citizens would be fined for not showing personal responsibility?
I stand to be corrected on this because I'm not 100% certain of my numbers. I believe the numbers we're using does not include those who are undocumented. I think the numbers that we're using are only, I don't think it does. I think the 46 million includes only people who are lawfully in this country or American citizens. I don't believe it includes undocumented because, quite frankly, the Congressional Budget Office has been scoring this based upon undocumented not being included in the cost issues at all. So I don't believe any of the undocumented have been put into this equation.
Okay, 60%, according to the Pew Hispanic Center, according to the Pew Hispanic Center, 60% of the people that are here illegally do not have health insurance, so they would fit in there somewhere, correct?
No, not necessarily, because they don't show up in the numbers.
They show up at the hospitals.
They do show up. We do show up in hospitals. There's no question. They're part of the uncompensated care in a hospital, but they don't necessarily show up as the numbers that we're working with. But let me again tell you, we need to talk about immigration reform. In healthcare reform, we are going to be talking about, from the point of view of the requirements and subsidies, are going to be those who are lawfully in this country. Okay.
What we're really talking about tonight is the cost of health care, not the health care itself, because that's pretty good. So, what are you going to do about attacking the problem to amplify what the previous questioner said about lawsuits, which drive the cost up, about the cost of drug research, where you could subsidize the drug companies to do that research and lower the cost of the prescription drugs, about specialized health care where that special technology that costs tremendous amounts of money needs to be put in various places and managed. Are all of those elements part of the health care debate? And secondly, is Congress, are you willing to go under the same plan that you're going to give us?
The answer to the last question is definitely yes. Now, let me, though, take exception with you on your premise. I want to take exception with you on your premise. And that is, we do have the most outstanding health care facilities in the world located in the United States, including in our own community. If you have a complicated illness or you want to get trained in medicine, you come right here to the United States. You come right to Maryland. I agree with you there. But I disagree with you that this isn't an issue about quality. It isn't only cost. We're talking about cost, quality, and access. Too many people in America are not getting the quality health care that they need. They may be spending a lot of money, but they're not getting the quality care that they need. When you look at the international statistics,